Chris Hemphill with HonorHealth and
Seth Kaplan with HonorHealth.
And the reason that we're here is that we were asked to do a product demonstration for HonorHealth's platform. But we thought about what you might be able to learn from that. And while you would come away with it very good at using the HonorHealth Centauri CRM, it might not necessarily, we wanted to provide something that you could actually use and apply in your work. So broader than how to use us as a platform is the relationship that you would have with a CRM vendor and AI platform. So we thought that it would be a great example to, rather than talk about using the product itself, to get to dig into how to properly evaluate CRMs, how to work with your vendors and work with your partner organizations, and ultimately, with all the work and the impact that you're driving, be able to prove that to your leadership team. So HonorHealth, they've been a client of ours for several years now. They've run many campaigns that span the gamut from things that like more traditional marketing campaigns to things that were generated with artificial intelligence. So Seth has been a leader in evaluating and driving success in all of those fronts. So we wanted you to hear from him on strategy in terms of evaluating and working with an AI partner. Before we jump into that, any thoughts that you'd like for folks to come away from this with, Seth?
Yeah, so I'm hoping just to walk through our thought process as we were evaluating vendors, and then hopefully help you give the audience some things to think about while they're entering relationships with a CRM vendor.
So let's start there. So what were, Seth, the challenges that got you into evaluating CRM in the first place?
Yeah, so at HonorHealth, traditionally we had used CRM more on the marketing side. So we were kind of running campaigns and pulling lists and things like that. What we were looking to do, though, was really expand it so that it was an enterprise-wide system. We had other players. We had a call center that was coming on board. Our PRM group was also interested in utilizing CRM. And we wanted to find a tool that all of those different people could use, because we felt like having kind of an integrated approach to how we're communicating with patients, communicating with physicians was where we needed to go as an organization. So that was really kind of the catalyst to why we were looking at new CRM in the first place.
Wow, so it sounds like not just marketing, but you had to consider the needs of a bunch of different groups in this whole scenario. Love it. So in that process, how did you develop an evaluation process that met the needs for all those different constituents?
Yeah, so we went through an RFP process. We had stakeholders from each of those groups. We got together at the beginning and kind of everybody listed out their needs of what they wanted from a CRM product. So we had kind of a lot of meetings to kind of develop the requirements that we were looking for, send out the RFP. It was managed through our IT department, just because there were so many groups involved. We went back and forth a lot, and I think that we ultimately landed on using Actium because we felt like it was going to meet the needs of all those groups the best.
Excellent. And would you mind digging a little bit deeper into kind of why Actium Health?
Yeah. So I can speak primarily from the marketing side because that was the part of it that I was most involved in. We were in marketing. We were really having troubles with kind of list development and having a tool to help us to accurately report on the programs that we were running. So that was really important to us, is to find a partner that could had a platform that was easy for us to kind of self-serve for the marketing needs that we have like list development and things like that. And then on the reporting side as well, we were also wanting a partner that could kind of be someone that we could work together with really closely.
Mm-hmm.
So I think that you look at platforms like Salesforce, which are robust and do a lot of things, but when it came down to having someone hold our hands and help us set it up and help us to use it, we really felt like in order to get that level of service from Salesforce, we would have needed to hire another consultant to do that. Whereas with Actium, it was kind of all part of the package that they presented.
Excellent. So let's dig a little bit deeper into that partnership, because like after the evaluation phase, there's still, we're not done yet just by installing a piece of software. I'm not done when I put Windows 95 on my computer, not by any stretch of the imagination. So just what are some of the go-tos or ideas like when it comes to successfully managing this relationship, driving campaigns and things like that? What are some of the words of wisdom that you would give to folks that are managing relationships with data-driven platforms?
Yeah, so we just have a very close working relationship with the Actium team. So we have a standing weekly meeting where we'll talk about priorities and initiatives that have come in from the organization. How the organizational needs are shifting. We're just kind of really transparent in that meeting. The Actium team then kind of takes that in and helps us to prioritize things. They'll suggest, if we are going to run XYZ campaign, we need to move this other one, that type of thing. So help us kind of with the project management of it. I would also say that they are pretty good about coming forward with new ideas for us. So, they'll say, we ran orthopedic campaign in this other market that we're in, and these are the successes that they had. Would you be interested in doing something similar in your organization? And sometimes the answer is no, sometimes the answer is yes, though.
So for the folks out there taking notes, it sounds like there's a lot of focus on having a frequent touch point with the organization, whoever you're working with, and also being open or hoping that they'll be open too to share ideas on what kinds of campaigns, what kinds of strategies have worked with other similar organizations. One thing that I'm curious about too is kind of like a lot of people watching might be curious about managing relationships or understanding like cutting through the hype on the AI aspects of the platform. Would you share any stories with regards to a campaign that was launched and used artificial intelligence?
Yeah. So we've done several campaigns using the artificial intelligence. The first one that we did was a Heart Month campaign. So we typically run cardiology campaigns during February for Heart Month. Typically, we're asking people to sign up for an event or take a health risk assessment, and the audience development of that has had traditionally been that we just sent out an email to the people who had attended events in the past, and we'd get interest, but it was the same people that were coming over and over again. What we wanted to do was really be able to generate net new patient volume to our cardiology service line. So we started kind of going down the path of using the AI modeling. We had a really great partner in the cardiovascular service line that was willing to try something new and wanted to work with us to kind of develop that outreach. So that was a super helpful piece of it. So I would tell anybody that's kind of wanting to explore this is to really make sure that you have a champion on the operations side in order to kind of bring it forward and kind of be someone that's supporting you and kind of bringing a new concept to the organization. And then also, we were kind of brought that operations leader into our Actium team meetings. They were like really part of the whole process. We shared, Actium was very transparent in terms of what went into the model, and the operations teams was able to make little tweaks here and there just to meet the needs that we had. So it was kind of that partnership that made it successful.
So one thing that also seems like it would be really important in having a good partnership is communicating these results to leadership. Could you share some advice or thoughts, or maybe even if you use the example of the cardiology campaign that you just mentioned, what's some advice in terms of getting this out, getting a discussion around this, telling the story around this data to leadership and getting them to invest more in the CRM and AI efforts that you're doing?
It's primarily in the beginning, we're looking at the leading indicators, so the open rates and click-through rates of the email communication that we're sending out. I would say the operations team, they were interested in those statistics, but I think that they don't totally understand them the same way that we do on the marketing side. So having a benchmark comparison that we could show, typically what we see with a campaign like this is like a 20% open rate. This one got a 44% open rate. So really showing that the model was working. At the end of the day, though, that what they really wanted to drive for was the appointment volume. And so we were able to kind of track that all in the system, see the appointments that were scheduled, kind of show the lift that using this model brought over just going with the traditional way that we had done it, looking at past event attendees. So I think that these programs have been so successful for us. The data really speaks for itself. But it is important to kind of get in front of those operational leaders, make sure that they are seeing the real-time results. I would say, as we've been doing that, these operations leaders that we've had have become real champions of these programs. So where in the beginning it was like we were trying to find the right leader to kind of do a pilot experimental thing with us. Now it's kind of like a standard practice for us that we do AI-driven campaigns, and the operations leaders are now coming to us saying that they want to do it for their service line. So it's in a relatively short amount of time we've seen that kind of flip where we were begging people to try it with us, and now it's like they're begging us to do them. So
that's a great way to close the loop. All right, so let's start out. 280 characters or less. What is the most important thing that folks should know about evaluating a CRM and AI platform?
Yeah, so I think that it is understanding everybody's needs and finding the solution that can meet everybody's needs the best.
Excellent. So number one, understand strategy. Number two, okay, so in your partnership and in working with with these vendors and on these initiatives and on campaigns, what's the most important thing that folks should know from that? 280 characters. You did really well with it.
I think it's constant communication, like making sure that if possible, over communicate. So making sure that the partner knows your goals and I think that as the more we can communicate, the better.
Excellent. So bug your partners and let your partners bug you, because there's going to be some great interplay back and forth. So keep that relationship going. And number three, what's on a whole lot of people's minds is making it real for leadership. What's the most important thing there? 280 characters.
Yeah, I would say let the data tell a story. So don't just present numbers to talk about like how what the lift is, what the real kind of story is, and make it easy for them to understand.
Excellent. Wow. Yeah, make it easy for them to understand. And another point that he had made later was around the types of metrics that you use. As much as we can be proud of something that doubles the open rates, I mean, that's awesome. But when it comes to talking to leadership, they're going to be more concerned with the amount of appointments and volume that you're able to drive. So we hope that this has been helpful in learning how to evaluate AI platforms, work with vendors, communicate results. And if you're interested in learning more about that kind of stuff, you can follow us on YouTube. We do conversations like this once a week on LinkedIn Live. So look up Actium Health on LinkedIn, YouTube, and even our Hello Healthcare podcast. Thank you.